The project, Scaling Up NCD Interventions in Southeast Asia, or SUNI-SEA in short, aims to strengthen the response to non-communicable diseases, or NCDs, in communities and primary healthcare facilities. The focus is on improving national NCD control programs, policy change, and scaling up activities to reach more people. Our work in the past 4.5 years, from 2019 to 2023, in the 3 project countries, Indonesia, Vietnam, and Myanmar, focused on tackling NCDs through a comprehensive approach, fostering collaboration among key stakeholders, communities, health volunteers, healthcare providers and health managers, local government leaders and policymakers. In Indonesia, we trained health volunteers, or kaders, and staff at community health centers. We made sure to involve more young people and men in primary healthcare centers, or pospindus. To make access to healthcare easier, we provided referral cards to people attending pospindu screening events who had risk factors for hypertension and/or an abnormal glucose levels. In addition, we developed a mobile phone health application to connect patients and service providers. This application helps kaders identify risk factors for NCDs. Our goal is to integrate this platform within existing government applications. We also advocated for village funds to invest funds for healthcare by showcasing best practices to decision makers.
Selain pelatihan, itu juga ada bimbingan, ya, pendampingan dari tim-tim SUNI-SEA, baik kader maupun dari kita juga selaku petugas dari PTM. Jadi kolaborasinya sudah cukup baik, tinggal menerapkannya kita dalam penyakit tidak menular.
Pospindunya kebetulan saya di situ bertugas sebagai pengecek gula darah. Enggak gitu. Dulu saya itu tidak pernah tahu bagaimana cara pengecekan gula darah, kolesterol, asam urat, saya itu nggak pernah tahu. Tapi setelah adanya pelatihan di Gayeng dari SUNI-SEA, kita jadi tahu gimana cara mengukur lingkar perut, tinggi badan, nggak gitu, serta pengecekan gula darah, asam urat, dan kolesterol.
In Vietnam, the SUNI-SEA project was endorsed and supported by local health authorities. We received strong commitment from health facility staff and actively engaged local stakeholders. Collaboration with the intergenerational self-help clubs focused on NCD screening, referral, and follow-up of people with NCD risk factors and health education. We empowered community members for NCD prevention through promoting healthy lifestyles. Health workers received training on behavioral change communication and management. Referrals and trainings helped enhance collaboration between health centers and communities.
Sau khi sàng lọc câu lạc bộ là tôi tham gia câu lạc bộ, thấy bổ ích và câu lạc bộ sẽ biết được bệnh của mình là nguy cơ là cao huyết áp. Vậy là câu lạc bộ giới thiệu tôi sang trạm y tế để khám lại.
Phải nói rằng mô hình câu lạc bộ liên hệ tự giúp nhau thành lập ở tỉnh Ninh Bình cho đến nay là đã được 93 câu lạc bộ. Trong đó thì có 25 câu lạc bộ được dự án 2 tài trợ, dự án SUNI-SEA. Những cái sự phối hợp chặt chẽ, đầy trách nhiệm của hội người cao tuổi và ngành y tế trong cái việc chăm sóc sức khỏe thông qua cái mô hình câu lạc bộ là một cái việc làm hết sức có ý nghĩa.
Since February 2021, our program in Myanmar has shifted its focus towards working closely with the community. To achieve our objectives, we introduced an online learning platform on NCDs to ensure that healthcare workers have access to the necessary knowledge. We developed an NCD self-care mobile phone application that allows community members to self-assess their health even beyond the project timeline. The application also includes a mental health assessment feature, which is in high demand.
ဒီ application ကိုအသုံးပြုပြီးတော့မှကျွန်မအနေနဲ့အကျိုးကျေးဇူးတွေကအများကြီးရရှိပါတယ်။ဘယ်လိုအကျိုးကျေးဇူးတွေလဲဆိုလို့ရှိရင်ဒီ application ထဲမှာပါတဲ့အကြံပေးချက်အတိုင်းပေါ့နော် application ပေးတဲ့အကြံအညာအတိုင်းလိုက်နာနေပါတယ်။ဥပမာ lunch water တို့အစားတွေအငံတွေဆော်စားတာမျိုးပေါ့နော် အချိုတွေစောစားတာမျိုး
အဲ့ပြီးတော့ကျွန်တော်တို့ဒေတာမှာဆေးရုံဆေးခန်းတွေဝေးတဲ့နေရာမှာအခက်အခဲတွေကျန်းမာရေးအခက်အခဲတွေအများကြီးတွေးကြုံနေရတဲ့အတွက်ကျွန်တော်ဟုတ်ကဲ့ဒီ SUNI-SEA စီမံကိန်းကျေးဇူးကြောင့်ကျွန်တော်တို့ရွှေတလူအဖွဲ့နဲ့ဒီဂျေးရွာမှာရှိတဲ့ပင်းတရမြို့နယ်အတွင်းမှာရှိတဲ့ဂျေးရွာ56ရွာမှာရှိတဲ့ဒီပြည်သူလူထုတွေကိုဒီကျန်းမာရေးနဲ့ပတ်သက်တဲ့အသိပညာလေးကျွန်တော်တို့ရရှိခဲ့ပါတယ်
Our research shows that there are common trends in the countries where we are working. We experience that many primary healthcare workers and community volunteers are highly motivated. They really want to help people. However, to do their work well, they need essential materials and equipment for health screening. They need medicines for treatment of NCDs. With more support and supervision, they can strengthen and maintain their knowledge and skills. Many primary healthcare workers have not received enough training on NCDs during their pre-service training. They are eager to learn. The training modules and information materials that we developed are used a lot. Capacity building for NCDs should therefore be embedded in a program of continuing professional development. We have very good experiences of working with communities. Community approaches work best when neighbors, friends and families help each other. Peer support helps people to participate in screening and to achieve healthier lifestyles. The United Nations aim for universal health coverage is that all people should have access without financial barriers to quality care. As NCDs are the most prevalent diseases all over the world, responsible for 74% of the deaths globally, these chronic diseases should be included in universal health coverage. This requires that governments sharpen their policies. A component of UHC is access to diagnosis and treatment of NCDs. Health insurers therefore should adapt their health insurance coverage packages to include this. Policy changes such as updating laws on sugar, salt, tobacco and alcohol are necessary.
By addressing the gaps in healthcare interventions and fostering synergies at all levels, we can make a meaningful difference for NCD prevention and control throughout Southeast Asia. Together, let's work towards this realization, ensuring healthier communities and brighter futures for all.